Well, Tim, thank you very much, and thanks to you and your staff for taking the lead on putting this very important hearing together. Thank you to all of our panelists, to all of our guests for being here. You are speaking truth to power. That's the best of America, when we stand up to those that are in our government, are in positions of authority, who are trying to take from the dispossessed, from the most powerless in our country. We call this bill a betrayal, and Tim said it correctly, because to us this is a betrayal of our fundamental responsibility as public servants. We are supposed to create a world in which everyone has a shot at the American dream, in which everybody, if they work hard and play by the rules, have a chance at economic mobility, have a chance to do well for themselves, but also for their children. And so that means looking at the folks who are at the lower rungs of the economic scale and making sure that you are putting them in a position to succeed. And we know for far too many working Americans, for folks that are making the minimum wage or just above the minimum wage, right now, they view this economy as rigged, as working against them every single day of the week. And why this bill feels like a betrayal is because, as written, it makes life infinitely harder for the very people that we are supposed to be fighting hardest for, the people who are working every day, playing by the rules, often dealing with traumas and difficult life circumstances. And for what? In order to enrich at disgusting new levels the folks who life has treated pretty well, the people at the very, very top of our income pyramid. Depending on how you cut the analysis, the percentage of Americans who are going to lose money differs, but it's an extraordinary number of low-income and middle-income Americans. Upwards of 40% of all American households, if this bill is implemented, will be poorer because of it. Well, the very rich and the very affluent will be much richer. The very richest families in this country will get an average $270,000 tax cut because of this bill. Most families in this country can't imagine what it's like to live on $270,000 for a year, and yet that's the new amount of money that will be coming into families at the toppest end of our income pyramid. So this feels like a betrayal of our responsibility, which is why we're using these spotlight hearings to just uncover and unpack what the real world impact is on families, to take one last shot at convincing our Republican colleagues to, at the very least, make changes so that lives are spared. And let's just be honest, when you're talking about almost $1 trillion in Medicaid cuts, when you're talking about throwing upwards of 16 million people off of their health care, you are talking about life and death stakes. This isn't just about impacting the quality of someone's life. This is about ending people's lives. One research estimate is that 42,000 lives could be lost each year because of the disenrollments in Medicare and the marketplace coverage. Just to give you a sense as we turn to our witnesses of the scope of this, because I know the numbers we throw around are kind of hard to understand. What does $1 trillion of cuts look like? What does it mean if 16 million people lose their health care? If 16 million people lose their health care, that's the equivalent population of the entire population of Idaho, West Virginia, Hawaii, New Hampshire, Maine, Montana, Rhode Island, Delaware, South Dakota, North Dakota, Alaska, Washington, D.C., Vermont, and Wyoming combined. That is a healthcare cataclysm. And that doesn't happen without the impact being so significantly deep, even on those people who still retain care. Because the estimate also suggests that because of all of this withdrawal of money out of the system, especially the system that supports care for folks on the margins of our economy, up to 340 rural hospitals could close. 33 hospitals in Louisiana could close. 35 hospitals in Kentucky could close. 40% of the rural hospital capacity in Alaska could disappear if this bill is passed. So even if you keep your coverage, even if you are lucky enough not to be one of the people that are thrown off their care, your life could be impacted because your ability to get your loved one to an emergency room when you need it could disappear. So I want to thank Tim. I want to thank my colleagues who are going to arrive as you give your testimony for the questions that they will ask. We literally just moments ago got a new updated Congressional Budget Office analysis, and the news doesn't get better, Senator Kaine. It just keeps on getting worse. This new analysis says that the deficit impact on the country will be even bigger, now looking at $3.7 trillion in additional deficits, that the bill is going to increase interest rates. So on top of the fact that you're going to lose your health care, you're going to lose your nutrition benefits, you're going to watch the rich get richer, you're also going to pay more to get into that first house, to be able to borrow to put your kid through college. This is a really important hearing, and I'm looking forward to the witnesses helping us to tell the story of what's going to happen on the ground.